Good morning. I'm Shelley Feingold, Behavioral Health Program Coordinator with the Monmouth County Division of Behavioral Health, and this is the fourth webinar produced by the Emotional and Spiritual Group, which is part of the Monmouth COAD, Community Organizations Active in Disaster, and is co-sponsored by the Mental Health Association of Monmouth. Thank you for joining us, and welcome to our webinar, From Crappy to Happy. Wasn't too difficult to come up with that one. Many of you in the behavioral health world are feeling crappy, to say the least. That would be one word we can use in public for living a pandemic life and being on the front lines, serving those who need behavioral health services and some in very dire straits, along with many, many other personal life and work issues. And that is very much worth talking about. Today's webinar is about and for you. We hope you'll get something out of it and know that you are not alone. Our presenters are from the Mental Health Association of Monmouth, the Monmouth County Division of Behavioral Health, New Jersey Hope and Healing, the State of New Jersey Department of Human Services, and RWJ Barnabas Institute for Prevention and Recovery. We'll also be recording this webinar, and it will be available for a limited time with a link that will be emailed to you, and we urge you, share it, let other people have a shot to see this webinar if you'd like to share that. So in early May, we sent out a brief survey with 3 questions for those who work in behavioral health. We asked if you were management or direct staff, and found it interesting that we had an almost equal response with just a few more management responses. What is making life and work more difficult? We know it's really tough for helpers to ask for help. Many of you have had long careers where personal issues didn't impact work, but the current world is very different from anything any of us have experienced before. We heard you, and here are the most common responses. No surprises. For many of you, every day feels like an uphill climb just to stay level. All of you can relate to some of the responses, and for many of you, all or almost all of the responses. Time, family, clients, obstacles, personal safety. These responses were listed many times in many ways. As I said, this webinar is for and about you. Our speakers will leave you feeling just a little bit differently than you feel right now, we hope. And we will be sending out another survey soon, so please take a minute to answer a couple of questions, and remember, your responses are the reason that we have this webinar today. We mean it when we say we need to hear from you. So let's get started. Please use the Q&A options at the bottom of your screen for presenter questions. Post them anytime during the program. They will be monitored and answered. Our first speaker is Lynn Seward. Lynn is the Assistant Director of the Peer Recovery Program at the RWJ Barnabas Health Institute for Prevention and Recovery, overseeing and developing recovery support and case management programs that serve individuals with substance use disorder in communities throughout New Jersey. Lynn has developed innovative collaborative programs that bring community partners together to increase access, eliminate barriers, and better coordinate services across the continuum of care. Lynn is the current chair of the Professional Advisory Board with the Monmouth County Division of Behavioral Health and serves as the co-convener on the Monmouth Behavioral Health Hub. She received the Inventive Leader in Adult Prevention Services Award from the New Jersey Association of Mental Health and Addiction Agencies in 2021. Lynn?
Thank you, Shelley. Good morning, everyone, and welcome to this space. And I think I wanted to start with that being said, that it's been a difficult 2 years for everyone. And being able to hold these spaces for each other has been so important. When we started this journey of being isolated, it was apparent to me that I needed to create more of these spaces for staff to come together, to be able to talk about the struggles during the pandemic, what that meant to them. Really creating these spaces created an opportunity for people to talk. So many people became isolated in such a difficult time. And we started to see people with more anxiety, more depression, more anger, more fear. There was just a host of new symptoms, right? We call them symptoms to the pandemic. And so in these spaces, we created coffee hours. We would start a Tuesday morning with a coffee hour just so we could sip our coffee and talk about what was on Netflix, right? So creating these spaces where it wasn't about work, because what we found during these past 2 years is even though it was more convenient to be in this Zoom world, it increased the workload. I found myself going from meeting in Hudson County to Middlesex to Essex to Monmouth, back to back, sometimes 16 meetings a day. Where in the real world, before the pandemic and we were traveling, you could only squeeze in 2 or 3 of those a day. So I think we all started to feel a little bit more overworked, overwhelmed, and really couldn't find that balance. So I took the opportunity to create more spaces. You know, if I wasn't in an office and I was working remotely, I created virtual office hours, another place for people to pop in and share time together. Talk about things during the week that maybe were popping up at work, but another opportunity to be in that space together. I also took the opportunity to join every meeting in the community just to see people's faces. And I think that's, you know, where we came together with Shelley, Mary, and Dustin, and Marie. Like, this was another space for us to get in the room and talk about the real problems that were going on, the real crisis with the healthcare population, right? Those frontline workers. People started to utilize that space to say, you don't know what it's like. You don't know what it was like being in that emergency department, watching people through the window dying. And I don't think we were able to comprehend that unless you were on the front line, right? Unless you were a nurse in that emergency department or a peer recovery specialist or a doctor. So creating these spaces for people to come together and really talk about what was happening in the world, because it wasn't always happy. But out of that crappy, we were able to become happy, right? And I think the people that came out of this the strongest were the people that took the opportunity to get in these spaces. I work for a company where self-care is offered 3 times a week. And I implored my staff, and in the beginning, I made it mandatory, but then found out I can't really mandate self-care, but it was so important for people to take that half an hour 3 times a week to get in a different space and take care of themselves. So I think what we've learned from all of this is that taking care of yourself and getting in these spaces just to socialize and come together and talk about the real crappy that's happening brought us to a happier place. So I just wanted to share those opportunities with you and talk about what was real the past 2.5 years. And we're still, look at us, we're in this space together this morning. And I can't see any of you out there in cyber world, but I am so happy you're here joining us just to hear about what we've been going through for the past 2.5 years and how we're coming through it together in this space. So enjoy the rest of the webinar.
Thank you, Lynn. Joseph Galetta currently serves as the Director of Emergency Management for the New Jersey Department of Human Services. He is directly responsible for emergency management activities associated with the department's 7 facilities and 10,000 employees. He serves as the state of New Jersey's mass care lead, which includes sheltering, feeding, reunification, and distribution of emergency supplies during disaster response operations. He retired from the New Jersey State Police after 30 years of service and was leading New Jersey's Hurricane Sandy recovery effort along with our FEMA colleagues. Upon his retirement, he served as the executive director of the NJ211 partnership. NJ211 is a statewide help and referral call center for those needing health or human services needs. Joe?
Yeah, good morning, everyone, and thank you, Shelley and Marie, for inviting me to this webinar. I really appreciate being here. to just give a little insight into what it was like to be working on the front lines in the emergency management world. Because let's face it, as we heard, this has truly been a marathon operation for all of us. It seems like it's never ending. From the very beginning, we were working closely with our New Jersey Department of Health colleagues in establishing an incident management team to deal with this pandemic. And it ran the gamut, really, going to the State Emergency Operations Center, working very long hours there, coordinating response efforts to support pandemic operations, from delivering and deploying PPE across the whole state, and trying to store all the PPE to help people. So in the same vein, handling disasters that impacted the state. It was very weighing on all of us in the first responder world. But looking at the survey that was provided to you and looking at some of the answers, it's clear that as first responders in an informal way, we really mirror what you're feeling. The fatigue, trying to make sure you're safe, your family's safe, while at the same time, you're really up in the front lines dealing with many people and working in a congregate setting. It's very trying on all of us to deal with that. From my perspective, I noticed a lot of our volunteer groups didn't want to go to help out at the food banks because they were concerned. Red Cross volunteers, Salvation Army volunteers, we had to find other means to bring staff on board to help out in a crisis. So it was very weighing on all of us. So I put together a quick PowerPoint presentation. I'm going to see if I could share it. I hope I can. Can everyone see that? Okay, well, that's my contact information. I'll make sure I give it to you at the end of the presentation as well. But pretty much, as you look at this PowerPoint presentation, we work in coordination with the state police in emergency management. And as you know, the state police is responsible for developing the state's emergency operation plan. It's really an all hazards plan and encompasses all types of disasters across the preparedness phase, mitigation phase, recovery phase, and response phase of a disaster. But we always use the whole community approach. And the state emergency operation plan is broken up into 15 distinct sections. Here's what you see the sections consist of. The Department of Human Services is responsible for the mass care section. As Shelley mentioned, it's sheltering, feeding, distribution of emergency supplies, and family reunification. Each of these support functions generally has a state department that's responsible for crafting the plan. But we're responsible for the mass care plan. I always like to use this analogy, that formula there, the 4 C's plus the 4 P's equal an R. Not that I'm going to get into an E equals MC squared type of thing here, but when you look at the 4 C's, and it's kind of taken from the VOAD motto, Voluntary Organizations Active in Disasters, that communication, collaboration, cooperation, and coordination, and you add 4 P's, planning, preparedness, partnerships, and practice. When you do those 4 C's and you do the 4 P's, generally what you do is you equal a big R. And you would probably think, well, what does R stand for? R really stands for relationships, and relationships are the key. We can't do this alone. Don't just think the Department of Human Services coordinates mass care on its own. We rely on many different partners. We're talking from the government side, from non-governmental organizations, the faith-based community, community organizations, nonprofits, even the private sector. We rely on so many people, and it's the building of relationships that truly makes a difference in our response capabilities. But our ESF6 team represents probably the largest footprint in the state's emergency operations center when it's activated, as it was through COVID. And as you would imagine, the state EOC is a congregate facility, and people started getting COVID. So eventually they had to shut down operations and run the state emergency operations center in a virtual format. And you lose that face-to-face interaction, which is so critical in a disaster. I mean, granted, we could get on the phone and call one another, but it's much easier in that state EOC to walk up the aisle and talk to someone from transportation or health or agriculture if I needed something. But these are the 5 things that we really do. when we're activated. We handle sheltering, feeding, emergency assistance through some of our human services programs, disaster housing. We work very closely with the Department of Community Affairs, and human services, whether it's working closely with our disaster and terrorism branch, crisis counseling teams, disaster case management, setting up a family assistance center in the aftermath of a crisis or mass casualty event, or bulk distribution of emergency supplies. But understand this, behavioral health is a key component of all of what we do in mass care. I've recognized that when I was a trooper. I recognized that when I was working at NJ 211, and clearly now working at the Department of Human Services. It is so critical to have that behavioral health component be a part of your planning operations in disaster response. So all disasters pretty much require a behavioral health component. Disaster terrorism branch from our department holds a seat at our State Emergency Operations Center when we do have an activation. I rely on working with Megan Sullivan and her DTB team for guidance and support. If we open up a family assistance center, disaster recovery centers, any feeding operations, or a multi-agency resource center, a MARC, I want to have that behavioral health component there to help out survivors. But more importantly, we always focus on the survivors. It's us as well. I mean, this pandemic has been draining on me. I can tell you that unequivocally, but it's the people we help and us ourselves that need the help when in a crisis. So very important for that. Our disaster terrorism branch works closely with the county mental health associations and the county traumatic loss coalitions. And we work closely with our disaster response crisis counselors on our rapid assessment, deployment, and response teams, RADAR. So the DTB team has been great for us. We work very closely with them when we activate and when we respond to any type of disaster. Another big component of our operation is partnering with the faith-based groups. I know VOAD is a part of this seminar, Crappy to Happy. We work very closely with New Jersey VOAD, and New Jersey VOAD has a faith-based foundation within its team. So we always work closely with the faith-based community, and more importantly, the Interfaith Advisory Council that's out there as well when we try to get out there. And we can't lose sight of the fact that the clergy has been really front and center in this pandemic as well. So although they've been helping so many people, what about the clergy staff that have been doing so much? We want to make sure that we take care of them as well. It's important to us to understand that we really lose sight of it. We help out survivors all the time, but it's really us because we're on the front lines doing so much for many hours, and it becomes very draining on all of us. We have to think about us to be safe. September 11th, we had a family assistance center we stood up, and think about that. It was opened up in September, and it didn't close until March of 2002. That's a lot of time to be working and supporting victims and family members of 9/11. But it's critical. It's a critical need that we have to do. And you think about these mass shootings occurring across the nation, it only stands to reason that we will have to activate a family assistance center. And the mental health component is going to be so critical, not only to help out the people that were impacted, but for first responders that actually witnessed the carnage of that type of crisis. So a family assistance center is something we do, and we really rely on the behavioral health team to help us out with that. Other disasters with flood, storms, hurricanes, the COVID operation has been truly a marathon, but there's always a behavioral health component in our planning. The crisis counseling line is still open, the 866-202-HELP or 4357, or text NJ HOPE to 51684. The monthly webinars put on by our disaster terrorism branch and Hope and Healing have been so very beneficial, whether it's the question, persuade, refer webinars or the wellness for the new normal. We rely on the DTB team and the classes they put out there, not only to help the people impacted, but they've been very reassuring to first responders as well to take those training sessions. So I put down Megan's, her contact information for DTB. Megan Sullivan will go out of her way to support the mental health field, and everyone involved in helping out those in crisis. So please reach out to Megan if you have any questions. In summary, it's important to note, and I think I made the point, that the behavioral health really is a part of our mass care effort. I couldn't do it without our behavioral health team, and most of you on the front lines within the counties and the towns truly make a difference, and you have made a difference throughout this pandemic. We rely on you for so much, not only for those you help, but for us as well. You're helping us as well. So we try to engage as many partners as we can. I talked about that 4 C's plus the 4 P's equals relationships. Relationship building is critical throughout any type of planning operation, but more importantly, when you activate, to have that foundation of partners to help you out in a crisis. So we work closely with our disaster terrorism branch, the county mental health associations, the traumatic loss coalitions, the rapid assessment, deployment and response teams, the disaster response crisis counselors. We work with the chaplain corps, and of course the faith-based community. So our goal is to take care of survivors as well as ourselves as well. So main thing is to be safe, and I hope you all are safe. And please, here's my contact information. I'll go out of my way for anyone on this group. And I thank Shelley and Marie for inviting me here, and thank you all.
And we thank you, Joe. Thanks so much. Dustin Knobloch has a Master of Social Work and is the Director of Community Education and Advocacy at the Mental Health Association of Monmouth, where she supervises the agency's intensive family support services, mental health first aid, and intensive in-community programs. Dustin also facilitates MHA's Quality Assurance, Community Education Committee, and student internships. She believes mental health education is fundamental to creating healthier and safer communities, and she currently advocates for individuals and families living with mental illness. Dustin is a strong supporter of the National Alliance of Mental Illness. Dustin?
Good morning. I'm so happy to be here. It's really an honor to speak to all of you today, and I'm just so pleased that you've taken a bit of time out to join us today. So I actually had the privilege of joining our CEO, Wendy DePedro, at the Mental Health America conference last week. And as Joe has said, and as Lynn has said, relationship building is really key to what we're doing and what we're up against right now. And I was able to go to that conference and not only hear from CEOs and EDs, but also people with lived experience and our young people. And I really did come back feeling a bit more connected, a bit more motivated, and a bit more equipped. So I hope that with what I share with you today, you can take some of those things away as well. So I am going to start with some of the statistics to kind of validate really what we're seeing right now. They're kind of a bummer, but I do think it's necessary to kind of take a snapshot of what we're seeing. So one of the tools that we have through Mental Health America and through our MHAs throughout the nation, and our MHA of Monmouth, our Mental Health America screening is the Mental Health America screening program. So what you can actually do, and I listed the website here, is go on to the Mental Health America website or a local MHA, and you have the ability to take an online screening tool depending on the types of symptoms that you're feeling. So there's about 10 different programs that you can screen with, or areas that you can screen within, including anxiety, depression, bipolar, trauma, and I believe postpartum, so on and so forth. So we actually launched this tool back in 2014, and it's always been a wonderful tool and a really great way to take a snapshot of what we're seeing. But this tool became incredibly meaningful throughout COVID-19, right? It was a tool for people to log on from the safety of their own homes with complete anonymity, and kind of see where they're at, right? And score their symptoms and refer to help, okay? So what we learned from our mental health screening statistics or from the mental health screening program is that in 2021, we had a 500% increase of the number of people who completed a screening. So that's substantial, right? We also know that the percentage of those screening for anxiety during that time were scoring at nearly 80% of moderate to severe symptoms, okay? And that's similar to what we also saw with our depression screenings, right? Again, there was a 304% increase at that time, and we're scoring at 85, and those scoring with 85% or higher with moderate to severe symptoms of depression. Take it a step further, tapping into our youth, on average, 90% of the 11 to 17 year olds who took a depression screen were scoring with moderate to severe symptoms of depression. We know that from those that were signing on and screening for mental health conditions, 63% reported that their symptoms were really influenced by loneliness and isolation, right? This is not anything new to us, and this is what was being shared throughout. I'm gonna go to the next slide. We take it a step further, we take a look at suicide. The percentage of those reporting frequent thoughts of suicide or self-harm in 2021 is the highest recorded since the MHA screening program launched in 2014. Right? This is absolutely significant with our youth, and we really are looking at an epidemic in 2021 within our youth and suicide. In 2019, the rates of reported suicidal ideation were elevated within the spring and summer months, so between April and August, and dipped back down in September through December. I bring this up because we're in the thick of it, right? We're right there right now. Our kids are also getting ready for the summer months, and it's a really challenging time for the people we work with and for us, right? Go to the next slide. So we take these statistics, right, that aren't very uplifting, and we are also in the midst of this incredible staffing shortage, right? I know as a community-based agency that's primarily Medicare, Medicaid, or contract-based, really being able to maintain and bring on new staff can be incredibly challenging. We have these private practices, almost, I want to say like corporations popping up, not only in New Jersey, but nationwide, that are hiring brand new individuals, those that are brand new to the field at really high competitive salaries with full benefits and oftentimes bonuses. And not only that, they have the ability to work from their own home. Right. So as we see this surge in our gas prices and inflation, why wouldn't somebody do that? Right. So that is really tough for our community-based agencies and also our hospitals. Our hospitals are tremendously overstaffed. Our crisis workers are under tremendous stress. Our screening workers are under tremendous stress, right? And now more than ever, we have people in the pipeline seeking help, yet we have two times more the turnover rate, right? And if we look at the Surgeon General report here, we're projected a shortage of more than 3 million low-wage health workers over the next 5 years. So we got some work to do, right? And we also know that more than 50% of nationwide public health workers report at least one symptom of a mental health condition. So we're feeling this. Okay, so we looked at some of those mental health stats, where we are with mental health. We talked about staffing, and you put that together. Let's talk about this pressure, right? As we said, as when Shelley provided the snapshot earlier of what some of us reported, never stops. It never stops, right? And I know for me, I oversee multiple programs at MHA, but I also oversee the bulk of our consultation programs. So my staff work all sorts of different hours. So I really can be working whenever, wherever, because I want to be there for my staff, because, they're really the ones who represent us out there in the community. Not only that, if you're a behavioral health worker, you're like a magnet, right? You go somewhere, you notice things, you see things, you want to help, or people naturally are driven to you, right? I know for most of us, our friends and family, who do they call? They call that mental health worker, right? It just doesn't stop. It doesn't end. One of the other things that came back from the survey, people are staying in the field longer. So people that were getting ready to retire feel this obligation to stay, this moral responsibility to stay within the fields. And that's not an easy position to be in, right? We're being pushed beyond our limits with continued rising expectations. And we all have this sense of responsibility and this call to service, right? I do want to highlight here, that's more of a happier moment, right? Is through the Behavioral Health Hub that Lynn had mentioned earlier. Early on with COVID, we recognized as a county and our leaders within the county that we needed to provide some type of counseling that was accessible to everyone and anyone. And we were able to provide that. And we continue to provide free supportive counseling to those whose mental health has been negatively impacted by COVID-19, right? We have this through the Mental Health Association in Monmouth County. I know that Marie will jump into that a little bit later, so I don't want to step on her toes too much. And you can get up to 5 to 6 sessions of free supportive counseling, regardless of insurance and all those types of things that could be barriers. I bring this up because when we started this program, we had over 75 highly licensed or licensed professional counselors, or licensed clinical social workers volunteer their time to be a part of this program to help our community. And I just think that speaks bounds as to really who we are and really how we really truly believe in our responsibility and the care of those individuals within our county and beyond. So, mental health, staffing shortage, pressure. Let's talk about resources. There was a lack of resources well before COVID-19, right? But resources have continued to be negatively impacted throughout COVID-19. So, for the first time in a long time, for those of you that aren't familiar with the emergency assistance process, but the Division of Social Services is the single point of entry for homelessness in our county, right? And if you access emergency assistance through the division, you can be placed into what would be considered emergency housing for up to 1 year's time, okay? People are staying well beyond that 1 year's time. And a lot of that has to do with the pandemic and not being able to have people taken away from shelter, right? And the first time in 15 years, we have a wait list for emergency assistance. First time in 15 years. And we already know that housing is a tremendous barrier. So I think this is worth noting, right? We know the wait list for medications. We know the wait list for therapy. We also know that we're within a child psychiatry desert, right? So we need our young people to get the help when they need it, but there's just such a lack of psychiatrists, especially for our youth, not just in New Jersey, nationwide. One of the things that I can tell you is that there's advocacy around implementing more mental health into schools for our youth. We're also one of the few counties that has youth-based clinicians embedded in our psychiatric emergency screening services team, right? So we are really trying to do our best to meet the youth where they're at and keep them out of the ERs as much as possible, right? That can be an incredibly traumatic experience and sometimes make the situation a bit worse. Right now, and I will smile at Carrie, who is joining us on this webinar today, we were able to have a clinician on staff a few days a week in a local school. So for those kids that were identified of really struggling with their mental health, they have the ability to meet with Carrie on a weekly basis. And I know that's something that we're exploring more throughout our county, whether it's somebody coming in or actually having a staff member within the school district. So we know that with limited upstream access, it's leading to a costly stage 4 access, meaning, we follow the before stage 4 philosophy. We really we're not going to wait to treat our physical health, right? We're not going to wait to treat cancer in stage 4. That's how we should think of our behavioral health. And we really want to be able to provide that early intervention, early identification, and prevention to limit that stage 4, that crisis point, right? And do things a bit further upstream. Wanted to share this quote because, again, going back to our youth, I think it's something we really need to focus on. And as cheesy as the Whitney Houston song is, believe in our children, they are our future. I'm not really even sure, but it's the truth, right? We have a lot of work that we need to do with our youth, especially, as far as we want our future to look like. And one of the young adult panelists, she said in one of the presentations at the conference, at 20 years old, I feel like I've experienced the world. And I sat with that for a second, and I was kind of like, think about when you were an adolescent. Yeah, there were some good times, but adolescence isn't like that super fun time in your life. You got all this stuff going on, right? So to really think about where we were and how we felt at that time, and then throw all this other crap into the mix. It's not easy. It's not easy stuff for our youth. Okay, so talked about all that stuff. So now let's talk a little bit about what can we do, right? I think it's really important that we understand what motivates our staff. Every staff is different and different things motivate them. So having those conversations, building that connection, what's important to you, right? And letting them know that what they do is important and what they do does matter, right? Because especially if you're working in a community-based program, if you're working in a hospital, and we're out there oftentimes dealing with some of the most vulnerable individuals living with severe and persistent mental illness. Seems like you're on a hamster wheel, right? Some days you just kind of sit there and you're like, what did I do today? Did I make a difference today? And most times, yeah, you did. But we have to be able to pull out those small accomplishments. Okay, maybe Johnny's not housed today. Johnny may not be housed for another 2 years, but you had a really positive conversation with him today and he opened up to you a bit, and that's never happened before. So we need to hold on to those types of accomplishments, right? And our staff need to feel a sense of purpose, efficacy, right? What am I doing this for? And oftentimes what I say to our staff, especially, I previously had worked with the homeless, and then I clinically supervised our homeless program for a number of years. And I would say to the staff, think about if you weren't providing that service, what would that person's life look like, right? And of course, we want to instill pride in what we do, and we want our people to feel proud about what we do, right? If we can try to reduce some of the administrative burdens, right, that are put on some of our leadership, right? The more time they have to spend with their staff will certainly improve the quality of care to those we service in the community. We need to prioritize social connection and community as core value of our workplaces, right? It enhances job fulfillment and it protects against loneliness and isolation. And again, that will directly impact and positively impact the quality of care that we are delivering. And again, that goes all back to that connection piece that we've all been talking about and that relationship piece that we've all been talking about throughout the webinar today. We had a really cool moment about 2 weeks ago. We had our annual dinner and, everybody had kind of packed up and was going home for the night as far as the attendees, and the staff, there was this one table and a few staff were sitting around it. And then all you see is more and more chairs being added around that table. So the end of the night was me and obviously other staff, but just surrounded by each other and just hanging out, talking, right? And that's not something I've seen in a really, really, really long time. And it was just so important to be able to talk and be with each other in that way, right? And I really hope that we got a picture of that moment. I'm going to have to check with the person that was our photographer for the night. And of course, always breaking down those silos, collaborating, as Lynn had shared as the Monmouth County Behavioral Collaborative person, right? Being able to come together in those spaces and really talk to each other, not just within our own agencies, but throughout the county. And I do think that we really do that in Monmouth. And there's just so many examples of how we do that within our county. And I'm really, really proud to be a part of that. One of the things that we've done at MHA is we have a community education committee. And what we do within that committee, it's really about bringing mental health awareness to the community in the hopes that we, break down those barriers of stigma and people get the help when they need it. But what we also do in that program, it's open to our community, our staff, and our board. So I think it's pretty cool to bring in our community, right, our staff, and our board members. And in that meeting, we have programs presenting to programs. We have direct staff talking about not only some of their accomplishments, but really the hardships of the job. What does this really look like? And it allows our board to also hear really what are we doing on the front lines? What does this work truly look like? And I think that's incredibly valued by our staff and by those community members that have joined us. So we continue on with increased leadership meetings, and I certainly know at MHA, we're really working on integrating our management team, or we continue to integrate our management team and our staff, right? So if anything, as long as we continue to care, we continue to support each other, and we continue to collaborate, I do think that we can make a difference in all this crappy stuff that's going on. And my last slide is to show you, after I have a crappy day, what I get to go home to, and it's my 4 furry, lovely, lovely animals here. So thank you all for today and taking some time. It's been my pleasure.
Thank you so much, Dustin. Don't let your address get out there. You have a line of people at the door wanting to see your adorable puppies. Next up is Marie Bocasino. Marie has a degree in communication arts and psychology and is a social services program coordinator with the Mental Health Association of Monmouth. She is a disaster response crisis counselor on the Monmouth County DRCC, and she's a statewide family representative for the DRCC State Advisory Board. Marie is the vice chair of nonprofit organizations and the co-chair of the Emotional and Spiritual Work Group for the Monmouth County Community Organizations Active in Disaster, COAD, in Monmouth. She's a facilitator for New Jersey Voluntary Organizations Active in Disasters Emotional and Spiritual Work Group, and she is the Faith-Based Leaders Peer Support Facilitator. Additionally, Marie is the facilitator of a parent focus group for caregivers of children with mental health and developmental diagnoses. She will be giving us an overview of resources and services. Marie? You're on mute.
Sorry. I was so enthralled with everybody else's information. I forgot to unmute myself. Good morning, everyone. So nice to see you all here. And we're so grateful that you joined us. And I want to thank the panel again for just making this all happen. You all are just amazing contributors to these webinars, and I am honored to be a part of them. So I am going to attempt to share my screen because we all know that that's how that goes. See, it already knocked me out. And sharing the screen. Okay, so I'm going to show you some resources that we have in the community. And here we are. So these are some resources to help you find the happy in the crappy. As many of you have seen in the past, we have a live document of resources that really started during COVID-19. We pretty much in April, as soon as we were all in, decided to put together pantry lists and update them, and just to make sure that everyone knew where we were at the time. It has now expanded to an over 59-page document. This is the most current one that we will be able to provide for you through the Behavioral Health Hub, Monmouth Resource Net, our constant contact through the Mental Health Association, Monmouth County. And of course, you could always reach out to me if you're interested in any information. And it literally, the information is from federal down to local Monmouth County and the state of New Jersey on a whole. You know, anything that we feel that could be appropriate to assisting people during what is still happening through this pandemic, as well as hurricane season, and just day-to-day resources to help people find the information that they need. As Dustin had mentioned earlier, we are still offering the COVID-19 6 free sessions. We actively have pro bono clinicians assisting people with supportive counseling at this time. We are so grateful for those who've reached out, and we're so wonderfully honored to be able to offer this opportunity to people. We are always looking for someone who's willing to help out. We know everyone is stretched beyond capacity, which is another reason why we're having this webinar today. We know that's a big part of the crappy, but we couldn't do any of it without all of you. And as everyone on the panel has been saying, how much we appreciate the hard work and dedication that everyone offers to help others. We are happy having a Getting Reconnected networking luncheon through our Navigating Wellness counseling program. It's going to be at the Soul Kitchen. Currently, there's a wait list because the response was amazing. However, please still register, because through Eventbrite, they are going to hold a wait list, and they're trying to see if we can expand it further to have more people. And it is obviously in person, lovely luncheon at the Soul Kitchen, and it's a great way for us to just do in person what we're doing right now through Zoom, to just get reacquainted and reconnected, and also a little self-care for ourselves, right? Have a nice lunch with everyone. We are also offering through our Navigate Wellness Counseling two groups called Navigating Emotions, and soon you'll see Navigating Wellness, Navigating Recovery, excuse me. These are through telehealth. They are going to be on Wednesdays, Navigating Emotions. It is a support group. This is not group therapy. One of our clinicians, Robert Baker, is so generously willing to offer this to people. It is no insurance is needed, which is wonderful. It is donation based if people can, but they don't have to feel pressure with that. And the beauty of this is, because there are so many wait lists right now with clinicians, it gives people another opportunity to be able to connect, to work on their mental health. Here's the Navigating Recovery. Now, this is more for people, this is for adults. with a substance use disorder or desire to reduce their dependence on certain substances. This will be Wednesdays, the second and fourth Wednesday of the month, and 7 to 8 o'clock at night. And the beauty of this too is one of the challenges is trying to find resources for people weekends and after hours. So the fact that this is later in the day, this opens it up to people also who can join these groups after work. Through our Red Bank Resource Network, we have a group called Mente Sana Vida Sana, which is Healthy Mind, Healthy Life. It is a bilingual group for the Hispanic community to help with information and education on various mental health challenges and just helping them to feel better and, you know, again, gather. It's all about gathering, as Joe was saying before about relationships. Everybody was talking about relationships. Lynn, Dustin. The beauty of Zoom, I have appreciated Zoom personally because it has allowed us to connect. But when you can connect in person, or you can connect with your peers, or you're able to connect with somebody when maybe you're having challenges getting that connection in other capacity, being able to have these opportunities we have found to be extremely valuable. And the next one is June 29th. Various organizations obviously are the big resource list that we have, covers various agencies and organizations throughout the county and the state. This just helps through the Y to have some basic, Perform Cares on here, and the Bayshore Family Success Center, and family-based services and various supports, as well as the helpline the suicide helplines, second floor, the various. When you contact me, there's ways that if we are not able to serve you in our outpatient program due to insurance or availability, I'm able to share what the Y is able to provide or CPC is able to provide. So please always feel free to reach out to us. Of course, we would love to be there for you, but we understand everyone has different needs. It could be scheduling, it could be insurance. So we as a community, I've been saying lately, it goes beyond a village. It now takes a state. And the beauty is we live in New Jersey, which is an awesome state. And Monmouth County particularly is amazing with its resources. As Joe was mentioned earlier about the need for the faith-based community. So we have been it's got to be at least a year and a half now, offering through the New Jersey VOAD, the COAD, the Emotional Spiritual Committee, Mental Health Association, a Zoom bi-weekly for faith-based leaders and clergy. I'm the facilitator. It is multi-denominational. It is literally a place just to come and talk and to support each other. Actually, we have it today. What happens in Zoom stays in Zoom, as I affectionately say, and we really want all the communities to know that we're here to support them, but that community in particular, because it's like all of the frontline workers. We are so busy assisting others that sometimes I think we just don't realize that we need the support ourselves, particularly that community. And that is why we were doing this webinar, because trying to help people go from all the crappy into a happier space environment. I love what Lynn was talking about, finding the spaces. These are spaces where people can gather to share where they're at and to find maybe that support that they're looking for themselves. I love the concept of beach yoga. I think it is one of the best things that we have this time of year. These are just a few that right now are available. If you can notice, it's Bradley Beach, it's Keensburg, it's Long Branch. They're throughout the county and the state. What I also love is a lot of them are either free or donation based. So definitely look into that. Don't feel some have certain fees, but when they're free and donation based, it opens up to so many other people that may not have this beautiful opportunity. And what better to be able to hang out on the beach at sunrise. Now, when we came up with this whole concept, we thought that we were, a little more unique, because I remember when we were chatting, I was saying, I'm just trying to find the happy in the crappy, not realizing when I did further research that this has been a thing for a while. So these are some reading material that maybe if you're interested, I have not gotten a chance to read them yet. I actually just purchased them because I was so excited to see that there's even books like this out there. and you'd be surprised. So the information's here, and you can always contact me if you're like, hey, what was that book? And here's my information if you need to reach me. And anytime I'm there at the Mental Health Association, I'm the information and referral specialist. So please feel free to give me a call, and I can share any resources or help point in any direction. And again, I am also reaching out if you have any information you want to share with us as well for the resource list, or just so that I can better help spread the word of what you're all doing. Please give me a call or an email. I'd greatly appreciate that on behalf of all. And I want to say thank you again. Thank you again for all you do and for just being a part of helping us find the happy in the crappy.
Thank you, Marie. Our final speaker and closer for the program is Mary Fowler. Mary is a disaster response crisis counselor and a New Jersey Hope and Healing crisis counselor with the RWJ Behavioral Health Institute for Prevention and Recovery. For the past 2 years, she's provided emotional recovery support and trainings to frontline workers and first responders. She is well-versed on trauma-informed care, coping skills, and resiliency. Mary began her work as a crisis counselor on the Superstorm Sandy grant and is on the Monmouth County roster as a DRCC team lead. She served on the Monmouth County Traumatic Loss Coalition lead response team also. Mary was program director and community trainer for the Upstream Suicide Prevention Grant, as well as an emotional recovery facilitator for Turning the Tides. When not doing crisis counseling work, Mary provides high-quality professional development trainings to educators, community service providers, and frontline workers. She's presently working toward her teacher training certificate in mindful self-compassion. Mary?
Thanks, Shelley. Thanks, everyone. Boy, it's hard to hold up the end of this wonderful ship, but I really appreciate being on this panel with everybody, and want to thank you so much for putting it together and for starting with that survey, of course, which was really telling. And I too am going to put up a PowerPoint presentation, and we will close this with a meditation that I hope you will all hang around for, because I think that we all deserve this. So it has been, okay, let's see, everything but my presentation. We'll find it. It's been a crazy morning on Comcast, and I don't know why, but my thing has been going out. Let's try that. Here we go. I just have too much. I have too much on my screen. That's my problem. Wonderful. So from crappy to happy. One of the things we did before we started this presentation this morning was we took a selfie, well, just on our screen, of our crappy face, and then we took one of our happy face. So maybe you want to do that on your own. Just take a good picture of when you're feeling crappy and when you're feeling happy, and put it up there, and then you get to choose. So here we were a couple of years ago, right? Very much like the dog on this couch. They moved my bowl. Everybody's bowl got moved. And, it's my great privilege to do the work for Hope and Healing, and to be on the front lines working with, I'm on the frontline worker team and the first responder team, and to be doing this work through the Institute for Prevention and Recovery, which does so much to help people navigate emotional difficulties and certainly substance use and abuse disorders. But this is the first disaster where we've all been in the disaster together, not as recovery specialists, not as helpers, but we are both the helper and the need of being helped. And one of the things that I found we would get a lot of pushback from when we were doing community programs was self-care. I got to thinking about it. Why? What is it about that word? Then I realized, it felt like just one more bloody thing you had to do. And so I thought, well, what if we think about it and reframe it as really what are we doing with self-care? We're caring for ourselves. And this is something that each and every one of us needs to do. We may need to get clinical help. We may need to reach out to any of the many wonderful resources that have been put up here today. But we also need to care for ourselves. And as mentioned, I'm embarking on a path of mindful self-compassion, teacher training. And so this is a lot of what we're going to be going over as we close out today. I do want to say also that the New Jersey Hope and Healing Grant is coming to an end. I think our final day is June 22nd. So I know it's been a great privilege for us to be in the field working with disaster, and on we go. So, let me go back one more minute and just talk about an ordeal. So what we know automatically about ourselves as humans is our brains are geared, they have a survival bias. We want to stay safe, so we look for threat. Whether we're looking for it consciously or whether it's that whir in the background, it's always there. And when we are in an ordeal, a lot of times what we have to do is we have to brace, we have to hold, we have to power through, we have to do the best we can. And then, things sort of kind of get back to normal. And that's when you find everything you've been doing this to is now suddenly opening up. Everything we've been holding in, all of the constriction, is now releasing. And what we know through a lot of the work is that suffering isn't necessarily something that we have to do when we are in the midst of great struggle. And one thing we might want to remember is that in the midst of great struggle, I hope we can all take a moment and reflect on just how strong we were, all of us, not just the people here on this webinar, but people in general. Yes, people are depressed. Yes, people are anxious. Yes, there's a whole host of problems out there. But are we also looking at the strength that we had to get through this incredible ordeal that was really life-threatening for each and every one of us at the beginning? So suffering, Kristin Neff, who's one of the pioneers in the self-compassion work, has this wonderful quote. It stems from a single source. When we compare our reality to our ideals, we want it to be something other than it is. But it is what it is, and how we relate to what is determines whether or not we suffer. So today we're going to focus on how we manage suffering, how we maybe perhaps don't even have to go to suffering by using 3 practices: self-compassion, gratitude, and joy, the emergency joy. So I'm going to start with gratitude to begin with. So we know there's a wide body of research now on the value of gratitude for mental health, for adjustment, for recovery. And what the research finds is that when we have expressed gratitude, when we pay attention, when we make note of what we are grateful for, what that does is it's not just about us expressing it, but it connects us socially, because it lets us know outside of ourselves, there is a greater force supporting us. Maybe it's a colleague who helped you out with something. Maybe it's that the sun rose after a few days of clouds. Maybe it was that we had a Memorial Day weekend, that it didn't rain. How shocking. Whatever things that you can be grateful for, it's suggested as one way of caring for yourself, not self-care, but caring for yourself, to make a note every day of 3 to 5 things that you're grateful for. Nothing too large, nothing too small. It doesn't matter what's on the list. It's just that we put that down so that we know in these periods of whatever is going on in our life that we are being supported and held. And the other thing that has been suggested as a wonderful practice for healing is to write thank you notes. You know, if somebody's done something for you, it's nice to say thank you, but when you actually take the time to write that note, you are seeing reflected in the words you put down on that page the feeling of gratitude that you had. So not only is it beneficial to the person who's the recipient, but it is also, again, beneficial to you. So the practice of writing it down and sending it, giving it, whatever that happens to be. And this is something, as we talk about the difficulties in our workplaces, the disconnection, the isolation, the overwork, everything that we, the helpers, might be feeling. These are things we could be, practices we can institute right there at work, in the office, or at home. You can do daily gratitude check-ins, 5 minutes, doesn't need to be a big deal. Because again, it's about shifting the attitude away from survival into noticing the things that are going well. One of the things I neglected to say about the survival bias is because we have this, we so often miss those things that we are happy about. We don't notice those mood states, but I bet if you track yourself for the course of a day, unless you're in a clinical experience of depression or anxiety, you may notice how many ways you're happy, what little ways you have peace, what little ways you're feeling some joy. So what we know with happiness is it is not the intensity. This is what the research tells us. It's not the intensity of the feeling of happiness, but the frequency and the duration. So paying attention to that which makes us happy, or to just noticing when we are feeling that way. And then another practice I heard at a Traumatic Loss Coalition, and I am embarrassed to say I don't remember the brilliant person who came up with this, but is look for your emergency joys. So one of the things that we can do when we're starting to feel overwhelmed, or when we're feeling totally overwhelmed, is do that connection and know, what are your emergency joys? Keep a list. I spent 3 months this year journaling every day about what gave me joy. And that list, those things that I journaled about, are now snippets of paper. So when I'm feeling the pressure, the concern, the fear, the angst, whatever is going on in my world, I've got something that I can physically pull out and say, do this now. I don't have Dustin's 4 dogs, but I am going to get her address. And we're going to, use those things that I know. So know what your emergency joys are, and don't keep them up here, because what we know is when we keep things in our heads, when we get anxious, what happens? The prefrontal cortex shuts down. It doesn't shut down, but it's not working as efficiently. So what does that mean? It means you can't remember. So in the thick of the moment, make visual that which you can't remember. And if you have these visual things around you, you're going to fare much better, because not only are you caring for yourself, but you are now also taking conscious, deliberate action towards your getting yourself from your crappy to your happy. Which brings us to self-compassion. And self-compassion is a 3-pronged approach to how we care for ourselves in difficult times. This research has been primarily advanced by Kristen Neff, who's at the University of Texas in Austin, and her Mindful Self-Compassion co-director, Chris Germer. And what they have identified as part of self-compassion, there are 3 things that we can do. One is our sense of mindfulness. To be mindful does not mean that we try to manipulate. Being mindful simply means we acknowledge what is as is. We don't try to judge it. We don't try to say, I like this or I don't like this. I want more, I want less. What we try to say with mindfulness is, I'm going to acknowledge, and I think we all can acknowledge here on this webinar, that these have been extraordinarily difficult times. We've been through a lot. We've been through an ordeal. And if we're not at the top of our game, if we're questioning what we're doing, or if we're like so many people, I don't want to go to the office, I do want to go to the office, just give yourself that. That's okay, because you've been through an ordeal. We all have. Which brings us to the second thing. First, in mindfulness, we notice where we're at. We then go to, what is our common humanity here? And our common humanity is that we have been in this boat at a very wide sea together. Our common humanity is everyone will feel this way from time to time. So it's not that we have a big giant suffering party, but it's that we acknowledge the end. You know how when we're feeling crappy, we want to isolate. We don't want to bring our stink around anybody. We don't feel sometimes worthy of connecting with others. So when we can share our common humanity and know that we've each been in those and we can each help one another, that is a wonderful thing to do. And then finally, we can treat ourselves with kindness. And within that kindness, we can actually, bring you through some practices that you can use to help yourself in those moments. Why is self-compassion so important? Well, let's just take a look at the neurobiology of it. First of all, we know that criticism, what does it do? When we're judging ourselves and harsh on ourselves, we're stimulating the amygdala and the brain's threat system. What happens with that is it can send us through criticism, we can go into overdrive. And overdrive can possibly lead to hypervigilance. And again, hypervigilance it's not that it's a bad thing. There are times when we want to be hypervigilant. We need to be paying attention. We need to be looking for threat. But if that's all we're looking for and we don't feel safe, that's a difficulty. So with compassion, what we know is it activates the prefrontal cortex, and it also activates the reward pathways in the brain. And when you can activate the prefrontal cortex and the brain's reward pathways, what we do is we slow the amygdala instant threat, we're in trouble response. So the more the PFC is activated, the more the threat system downshifts. And the more compassion we have, the more we learn, and this is so valuable, the more we learn to anticipate reward and the pleasure of it. So these are hard times, and compassion is a way we can deal with it so that we can anticipate reward and the pleasure of it. And the other thing that the research is showing is that compassion mitigates against anxiety and it mitigates against depression by expanding our window of tolerance and by also helping us to feel connected to one another, to humanity, and to treat ourselves kindly, not to judge ourselves or use these shoulda, coulda, oughta, woulda, I don't rise up types of words. So in caring for ourselves, what are we talking about? We're talking about the tend and befriend. The oxytocin part of that brain that we all want. Tend and befriend yourselves. So we respond to our pain with kindness. We soothe and comfort with compassionate understanding. And we reframe whatever we're experiencing in the light of our shared humanity. So one of the things we can do is we can each create our own compassion mantra. And a compassion mantra, you'll see within this particular one I put up there, is that it has a component of mindfulness, it has the component of shared humanity, and it has the component of kindness. So we begin with, this is a painful moment. This is a difficult time. This is the hardest thing maybe I've ever gone through. And then we can also note in there that I'm not alone with this. Everyone has felt this way at some point in time during this pandemic. Everyone is feeling this way coming out. It's not surprising that 90% of teenagers are feeling anxiety and depression. So much of life has been interrupted. So in a way, what we're doing is validating, and I don't want to say normalizing, but validating what is and understanding we're not alone. And then the mantra continues, may I be kind to myself in this moment. May I give myself the compassion I need. That's caring for self. And that's a brain tape we can put in so that we use it when the times are there and we're starting to feel the constriction, we're feeling overwhelmed, we're feeling like this is never going to end. You know, because it's no longer just the pandemic. It's all of the additive factors of things going on. And this will be very, very helpful. So with that, we're going to be closing. I'm going to lead you through a brief meditation, a compassion meditation. And it's nice that you don't have to be on camera so you can feel comfortable and participate. When we finish, the webinar is finished because we want to leave you not bringing you back into that brain that's active and engaged and just, you know, enjoy the chill a little bit and stay with us. So if you can find yourself in a comfortable seated position, and in that comfortable seated position, if you could just close your eyes if that's comfortable for you, or just close them 3/4, whatever works. And just take a few breaths, breathing in slowly through your nostrils, perhaps filling your lower abdomen, your belly, your middle chest, your upper chest. And then gently breathing out through your nostrils, releasing the air from your upper chest, your middle chest, your lower chest. Breathing in again. And breathing out. And just resting in awareness at this moment as you breathe in and as you breathe out. Now, noticing and paying attention, perhaps considering the question, how has my life been impacted over these past few years? And as you're reflecting, notice if you're experiencing or feeling any stress in your body, any tension in your body. Not attaching to that stress or that tension, but just noticing it. And validating. This has been hard. And just breathing into any tension or stress you might be feeling. Breathing in, 2, 3, 4. Breathing out, 2, 3, 4. Breathing in, 2, 3, 4. Breathing out, 2, 3, 4. Imagine sending your breath to that particular part of your body that may be feeling the stress. Perhaps it's your neck, your shoulders, maybe the top of your chest, maybe your back. Noticing your feet on the floor. And just validating, perhaps in a kind way, that I'm not alone. And noticing how it feels to know that you're not alone. And breathing in and breathing out. And imagining now that you are a thread, a piece of thread in a large piece of cloth, connecting in that cloth your human family. And breathing in and breathing out while you're doing so. Perhaps observing that thread as it moves through to different people who've touched your life, who you've been with, who you share. Now bringing your awareness and your attention to any of the residual discomfort you may be feeling, a sense of overwhelm you may still be feeling. As we know that this pandemic, the emotional after effects are going to go on for a while. And perhaps just using a slight gesture, maybe you want to rub one hand over the other in a soothing gesture of self-kindness. Or perhaps you want to rub your chest. And giving yourself words. How strong I was, how strong I am. How I have been so strong and so resilient through this. And express to yourself that I can be kind to myself. And in this kindness I express to myself, I will be relieving and caring for myself in a way that perhaps I never have before. And as you're breathing in and breathing out, reminding yourself that in this moment, I am whole and complete as I am. Reminding yourself that I am not alone. And that every time, every day, in every way that I show up kindly to myself, that kindness will radiate to everyone. It will bring a sense of peace and calm. Knowing that we have enough, that we are enough, that we have done amazing work in the most extraordinary of times. And I'm going to close with the meditation. So I will say 3 words, 3 sentences. Repeat these silently to yourself as I say them. May I be happy. May I be healthy. May I be peaceful. May I be happy. May I be healthy. May I be peaceful. May I be happy. May I be healthy. May I be peaceful. And now extending that compassion to self, to others, wishing others. May you be happy. May you be healthy. May you be peaceful. May you be happy. May you be healthy. May you be peaceful. May you be happy. May you be healthy. May you be peaceful. And now, to all of us, may we be happy. May we be healthy. May we be peaceful. May we be happy. May we be healthy. May we be peaceful. May we be happy. May we be healthy. May we be peaceful. And then when you're ready, slowly bringing your awareness back into the present moment. Just maybe taking a second to notice how you feel right now. And then because the day does move on, perhaps moving slightly, maybe just gently rocking your neck from side to side, perhaps wiggling your fingers and your toes. Noticing the space you created in your body. Knowing that this is a recorded session. May we all give a happy, our crappy to happy smile. We got there. On behalf of my Hope and Healing team, Tammy Reynolds, my team lead, Janice Mayer, our project manager, and the Institute for Prevention and Recovery, I'd like to thank you all for sharing your practice with me, for being here. And it's been an honor to work with such an esteemed group of panelists. These gals are awesome, and gentlemen, fantastic. So thank you, and have a beautiful